Hello, it can be very scary to see someone having a seizure. Even though most seizures will stop by themselves, knowing what you can do to help can make the situation less scary. There are different types of seizure, and this changes what you need to do. In a tonic-clonic seizure, a person is unresponsive and jerks or becomes rigid, especially in their limbs. They may start to breathe in a funny pattern and may bite the inside of their mouth or tongue, causing bleeding from their mouth. You may also notice foaming saliva coming out of their mouth. If you see someone having a tonic-clonic seizure, you should protect them from injury by clearing away harmful items such as glasses or sharp objects. Cushion their head from injury. Time how long the jerking movements last for. Once they have stopped jerking, lay the person on their side in the recovery position and stay with them until they are fully recovered, as it is possible that they might have another seizure. Remain calm. It is important that you do not do any of the following things. Do not restrain their movements. Do not put anything into their mouth. Do not try to move them unless they are in immediate danger. And do not give them anything to eat or drink until they are fully recovered. There are other types of seizures called partial or focal seizures. In these, the person may be unaware of their surroundings or of what they are doing. They may make unusual movements or behave differently, for example by smacking their lips, wandering around or plucking at their clothes. To help people who are having focal seizures, you can guide them away from danger such as a busy road or open water. Time how long their symptoms last. Stay with them until they are completely recovered and remain calm. Most people who have epilepsy will know how long their seizures last, how often they get them, and what they do during a seizure. It is useful to find this out in advance if you spend time with someone, because during or immediately after their seizure, they may not be able to tell you. If they are having a regular seizure, you may not need to call for help. But there are some instances when you should call for an ambulance. If this is someone's first seizure, if the seizure lasts more than 5 minutes, if they have repeated seizures one after the other without regaining consciousness in between, if they have injured themselves during their seizure, or if you have any other concerns about their medical condition. If you or someone you know has epilepsy, you can speak to your GP for advice.